Neurology, especially related to deep brain stimulation. We spoke to Dr. Hayden Boyce with Spectrum Health Medical Group about what this means for patients, especially those suffering with Parkinson's disease.
So deep brain stimulation is where we implant an electrode into the brain, and we're actually putting it into certain areas of the brain that help regulate movement. So if you're looking at patients that have essential tremor, their primary problem is tremor. You look at Parkinson's disease patients, they have tremor, they have stiffness of movement, they have freezing of movement. So we want to put it into these areas that help regulate movement in order to restore the typical movement that the patient should have. The last 20, 30 years, deep brain stimulation has really overtaken this, because now we can actually treat both sides, and it is a reversible procedure. This is an example of what the lead looks like. It's an electrode. There's a lead that has 4 electrodes on it, and that allows us to program to fine-tune the movement in the patients. You can see here that we have the lead secured to the skull using a plastic cap mechanism that is screwed onto the skull. The electrode is actually tunneled, the lead is actually tunneled down through the neck, and a generator is then placed in on the chest area, same place where a pacemaker would be placed. Typically what occurs is that the neurologist will fine-tune the DBS within the first 2 or 3 months. So in Parkinson's patients who tend to be on a bit more medications, it's a delicate balance where you're increasing the deep brain stimulation system while you're also decreasing some of the oral medications. Usually after 2 or 3 months they reach a steady state, and then usually for the first year or so it's probably a retuning every 6 months, and then it can become yearly. Essential tremor is a progressive disorder, but it doesn't have all of the features of Parkinson's disease, so those patients tend not to do as bad as Parkinson's patients. So a Parkinson's patient, for example, besides all the motor symptoms, they will also have cognitive dysfunction as well. Essential tremor patients, they're only facing just the tremor. So even if that tends to get bad, a lot of patients can actually have a good quality of life just on medications without having the deep brain stimulation put in. With Parkinson's disease, those patients that are good candidates have to have responded to Sinemet. If there's no response to Sinemet, they're really not a good candidate for a deep brain stimulation. We also try not to implant patients who have frank dementia. They can't cooperate with the exam. There's really not a benefit in implanting it in those patients. In addition, we want to make sure they have the classic Parkinson's disease. You know, if you have a Parkinsonian type of symptoms, you're not going to be a really good candidate for this. Most of the Parkinson's patients that we see tend to be older, and they will live with this in for the rest of their lives. The same thing with the essential tremor patients. The essential tremor patients tend to be younger patients, and they tend to be healthier. And again, they will live with this for the rest of their lives, but they tend to have a longer period of time with the deep brain stimulation in. Most of the essential tremor patients, we can actually come off of their medications. Parkinson's patients, especially the advanced Parkinson's patients, we may be able to wean off about 1/3, sometimes 1/2 of their medications. What tends to happen in Parkinson's patients is that as we increase the medications over time, they start experiencing side effects from the medications. So deep brain stimulation helps us to get rid of some of those side effects by decreasing the medications.
And for anyone who wants more details on movement disorders, there is a doctor dialogue taking place on April 22nd. It will be at the Prince Conference Center, which is at Kelvin College. For details on registration, go to shmg.org/events. And Dr. Boyce treats patients in Grand Rapids, Fremont, and Greenville. If you'd like to get in touch, please call 616-267-7900. And coming up on the Morning Mix, Humane Society